Hi there. This is Marielle Concepcion, your host of the My DPC Story podcast. Have you or someone you care about ever been burned by the U.S. healthcare system? If so, you are listening to the right video, because if you are listening, chances are the answer is yes. But the U.S. spends so much on healthcare. Why are so many Americans affected personally and especially financially by the healthcare system? Shouldn't that mean we have better healthcare access and treatment options? Shouldn't it be easy for us to be able to see our doctor when we need to instead of turning to the ER or urgent care? Historically, it's been seemingly impossible to answer these questions. But now that is changing through the direct primary care movement. This video that you have tuned into will bring you into the world of direct primary care and show you how physicians all over the country are changing the way they practice so patients from all backgrounds get the high quality care they need and deserve, which makes for both happy patients and physicians. Learn even more by subscribing to the My DPC Story YouTube channel. Find us on all major podcast platforms. Find us on socials at My DPC Story and at mydpcstory.com. There you can find resources including how to find a DPC doctor near you, conferences about DPC, DPC startup guides and advice, a store with DPC swag, and even a mapper showing where podcast guests are practicing. Thanks for tuning in to hear about this powerful movement. Now, on to the episode. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care means upholding the promise and desires I voiced in my interviews for medical school, which truly is to help people and ultimately gives me the ability to provide accessible and personalized medical care for each individual that comes through my door as a member. It means having the time with patients to build and solidify quality relationships where together we can improve and maximize their overall health and well-being. My name is Krista Springsteen with HealthSprings Direct in Tyrone, Georgia, and this is my DPC story.
Dr. Krista Springsteen is originally from Fort Worth, Texas, but has called Georgia home since 2015. She is an advocate for whole body health and helps guide her patients in behavioral, dietary, and habitual improvements to maximize energy and functionality, as well as to prevent life-altering disease processes. She practices medicine based on continually evolving scientific evidence, safety, and efficacy, while always taking into consideration the entire individual in front of her. She graduated magna cum laude from Texas Christian University with a Bachelor of Science in Biology and received a medical degree from the University of Texas Health Science Center at San Antonio in 2006. She did residency training at Christiana Care Health System in Newark, Delaware, and SSM St. Mary's Health System in St. Louis, Missouri, where she started on as a fourth-year chief resident and continued to teach fellow residents. Her experience also comes from her, now retired, husband's military career, and she has worked as a hospitalist, intensivist, occupational medicine provider, acute and urgent care physician, and primary outpatient internal medicine provider. She is certified to perform Class 1, 2, and 3 Federal Aviation Administration, or FAA exams, and Department of Transportation, or DOT exams. She enjoys time with family, Horned Frog football, and especially living and working through him. Welcome to the podcast, Dr. Springsteen.
So good to be here. Thank you for having me.
Absolutely. So you are in Tyrone, Georgia, 30 minutes outside of Atlanta. And I wanted to start with if you could share about your community. What are the demographics and what's unique about your community?
Tyrone is great because we call south of the perimeter, or STP. and it is very convenient to the airport, but it has a smaller town feel. And I serve many of the smaller communities nearby, Fayetteville, Peachtree City, and Noonan. Tyrone specifically is about 8,000 people, and there is a strong population of airline workers because the airport is so close. It's a good distance away from the airport, easy commute, but still has that small town feel. I love it.
Wonderful. And how long have you been in the community of Tyrone?
I live just south of Tyrone in Peachtree City, and I have been here since 2015 after many moves all over the country with following an Air Force spouse. And that was fun, but really happy to settle down, not move every 3 years, and hang a shingle. It's always been my dream, and really happy to start working as a primary care provider in the community and be an integral part of the community.
Recently, you had posted in Facebook group about Tricare insurance. And I'm wondering if you can share with the listeners about how Tricare comes to play a role in your community and in the healthcare of your community.
With the airport being so close, there are a lot of former military pilots in the area. And so a lot of them were retired from the military, and it could be any branch, but they have Tricare as their benefit for having served 20 years in the military. And that includes myself and my family. And it was a great benefit until we wanted to have more choices with our healthcare, and especially when I wanted to be a better doctor and went into the DPC realm. So not only was it frustrating as a patient, but it was super frustrating as a doctor not being able to care for the people in this area, because it was, as it turns out, one of the most restrictive HMOs in the country. Super frustrating that these guys and women work so hard for 20 years and they are provided subpar healthcare without the choice to expand it further.
And when you mention it being restrictive, extremely restrictive, can you give us an example of how it is restrictive for its benefactors?
So in order to be a Tricare provider, you need to enroll in the Tricare system, and you have to be opted into Medicare, and you have to submit any referral for imaging, specialty visits to Tricare and get it approved before the patient can be assured that they will get reimbursed by Tricare. And they will not allow any other financial models outside of exactly what they will reimburse. I was a Tricare provider at my former fee-for-service practice, where I was an associate physician for 5 years before I opened up my DPC practice in January of this year. And so I was able to do a little bit of referral after I left, but as soon as I opted out of Medicare, they shared the data with the government, and I received a letter saying, thank you, but no thank you. You're out as a Tricare provider, which limited a lot of what I was able to do because I started in January, and the people with Tricare Prime cannot opt for Tricare Select until open enrollment. So that was part of my post. I was frustrated that we're so close, and I'm still having patients go to my former employer just to be able to get referrals.
Definitely. And can you share the difference between the two options?
There's a lot of differences, and there's some significant intricacies, and it depends on when you started in the military, when you retired, if you retired from the military, if you have family, if you don't have family, but mostly Tricare Select allows you the option of self-referring. And the biggest downside is higher hospital bills if you have to be an inpatient, and higher copays for each specialty visit, which really adds up when you're talking about physical therapy visits. It's $30 a visit, which I know is not much compared to cash pay, but it's still something that they felt like shouldn't be there with the benefits that they were promised. Okay. It was a hard conversation to have with so many people because initially I didn't ask them what they had. I was don't ask, don't tell, but it was required. And I learned that the hard way by jumping in. And I was like, oh gosh, which one do you have? And so many of them had already seen the light and switched to Tricare Select, but there is a handful that we had to wiggle around, and they're all planning to switch to Tricare Select so that they can stay with the care that DPC provides for them.
So let me ask you, your previous practice, how far away was it from your current DPC?
My former practice was a 6-minute golf cart ride away from my house. And so that made it hard. We live in a golf cart community. There's 90 miles of golf cart paths. I like to refer to them as running paths, but people use their golf cart and they go to school and they go to the grocery store, and it's fun. The motto is living life at 15 miles an hour, and it's pretty nice. But it made it a really hard decision to move, because one of the other big lessons I learned was non-compete and non-solicit. I had it. I had talked to my former boss about removing it as a negotiating factor when I renewed my contract, and he politely declined. And so I am now 10.02 miles away from my former practice, and will be for 24 months total until October of 2022. So it's actually been really nice to have a 2-year plan where I didn't, have to take a loan out. I saved my money, I scrimped and got the necessary items, and I've slowly grown the practice. I actually didn't plan on it being so big so quickly. So there's a couple of things I would have done differently, but yeah, 10.02 miles, and I measured that out 8 times online.
Fantastic. And it's so important. And thank you for sharing that, because when it comes to especially people who are planning DPC as they're signing their very first contract, it can be something very important to pay attention to. It can be imperative to their practice, especially depending on their locale that they wish to practice DPC in. So thank you for sharing that.
Yeah, I would just go in and say, I'm not going to do this. This is not a part of it. And I know that the president was talking a couple of weeks ago about getting rid of the non-compete clause, and I was all for it. We'll see how quickly that can get in. Still, again, I'm very happy where I am. And that was the other thing, is I am in an executive suite situation, which everybody talks about subletting from other physicians. I have had an amazing experience with the executive suite. There's a receptionist at the front. She calls me when the patient arrives. There's a bathroom, really nice facilities. And I have this really large 12 by 17 foot room, and it has everything in it. It has everything I need. And it's perfect. I have a closet for my medications that I dispense. And I guess I want to emphasize that if you have an executive suite situation in your area, it's a really awesome opportunity for a low overhead, unique space that's all yours.
And with you mentioning this executive suite, how did you end up finding this 10.2 miles executive suite away from your previous practice?
I looked around and found places for lease. There was an executive suite situation closer to me that I was looking at doing. I knew I had the non-compete for, internal medicine, primary care, but I also do FAA physicals for pilots and really enjoy doing that. And so I was just going to get the executive suite situation near me. And my former boss kindly reminded me that I couldn't even practice out of my home, doing home visits and telemedicine services, because my home was within the 10-mile radius. So I said, I'm good, 10.02 miles. And I found an executive suite right at that perimeter. So I had the idea of it somewhere else closer, but then I found one. That was a little bit luck, but there was a couple of other options in the same range elsewhere.
And ultimately, why did you go with, I know you mentioned how you're finding these conveniences to be extremely helpful for your practice, for the space that you need it to be functioning out of, but how ultimately did you make the decision to go with the executive suite, having not been in an executive suite before versus the other options?
I was completely humbled with the response and how quickly I grew. I had a panel of about 1,000 patients because I was 3/4 time before in the fee-for-service. I was an associate and I didn't solicit at all. It was, she just left and they told everyone I went home to spend time with my family. But those patients are pretty scrappy. They find you. And Google's pretty amazing. And so I've done really well with the small space that I'm in. It's nice because I have the ability to reserve conference rooms. So if I need to do family meetings, I can do that. If I need to do classes, or there's a classroom with video AV capabilities, so I'm able to teach classes, nutrition, lifestyle modifications, a lot of anxiety talks lately. And so that's amazing. And then I recently hired a high schooler. She's amazing. I don't want to call her a high schooler. She's an amazing office assistant. She's a senior and she's doing a work-based learning program. She wants to be a nurse. And so she helps me a ton with the practice, a lot of administrative stuff, but then in turn, I get to teach her and we have enough time to do that and space within the executive suite.
When you say executive suite, I have no idea what that means. So the fact that you put out those details, like the amenities that you have that go beyond just an office space, is super, super helpful.
The nice thing is that it's all brand new. It's clean, it's bright, it's airy, and I didn't spend a dime on the finish out. And so it's nice that, I'm renting. I do, have a 2-year plan and a 5-year plan as far as expanding, and it'll come when it comes, and it's coming faster than I thought it would. And I'm so thankful.
Stay with us. We'll be right back. My DPC Story just hit 100,000 downloads on Apple Podcasts alone, and we could not have done it without our amazing listeners. So to thank you and to celebrate this milestone, we're giving away an incredible DPC Summit prize package for the DPC Summit happening in Minneapolis this summer. The prize includes My DPC Story swag, and on top of that, the prize also includes a ticket to the DPC Summit. Check out my interview with Dr. Jeff Davenport, where you'll hear more details about the summit. To be eligible for this giveaway, all you have to do is first rate and review My DPC Story on your podcast listening platform. Pro tip, if you rate My DPC Story with a 5-star review, it helps the visibility of the podcast and it helps others to find all these DPC stories. Number 2, take a screenshot of your review and email it to support@mydpcstory.com. You'll find that email in the show notes as well. And third, make sure you're following My DPC Story on all your social media platforms: Instagram, Facebook, TikTok, YouTube, LinkedIn, and Twitter. All the social links are at the bottom of mydpcstory.com and also in our show notes. For bonus points, share both this episode and the My DPC Story posts about the DPC Summit with your community. The winner will be announced in a future episode, so make sure you tune in to find out if you'll be heading to the summit. If you've already purchased your ticket and you're the winner, My DPC Story will send you a check for the price of your ticket. Thank you for listening to My DPC Story, and best of luck. With you mentioning that your patients have found you despite the falsehood that was implied when you left your previous position, is it through Google that most people are finding you, or is it also by word of mouth? How have people shared with you that they found your DPC?
Yeah, I did my own Facebook or my own website initially, just using Google Sites. That took me about a day and a half, and it was not fancy at all. And then I did a Facebook page, and then I did a launch. And it took me 2 weeks to get my own name back from Google from my prior practice, because they mailed the old practice the confirmation code to claim it, and they wouldn't give that to me. And so that was fun. Yeah. And they found me mostly through Google. And at first I just had my cell phone. In fact, I think my cell phone's still on Google if it's under my name, but it was my initial ways of communication. I have another business number now, and that's through the executive suite. So it's part of it, and slowly transitioning over to that. But yeah, they find you from, hunting you down at the grocery store. They find you from talking to somebody knows somebody who's on my kid's Little League team parent. And it's fun in that the small town feel, you all take care of everyone, and you're able to have the whole relationship. My dad was a dentist. I grew up watching him really be involved. And I knew I wanted to do something like that. I just didn't want to be in people's mouths all day. And so I have it, and I love it. And I'm so happy. With the whole 80s and the DMOs, whereas HMOs for doctors, he didn't opt in and kind of did his own DPC, but as a dentist. And I really look up to him. I'm proud of him, and I hope to achieve what he did someday. So here
you're doing it already. You are. This is so exciting. And I'm sure that mind shift will happen the more and more you're out in your 2 and your 5-year plan. But no, with you mentioning the small town feel that Tyrone has, when you were mentioning the fact that you do FAA physicals, did that have any restriction in terms of the non-compete as well?
No, because that wasn't a direct competition. The exact wording was, I'm not able to practice family medicine or internal medicine within a 10-mile radius. The urgent care was an option. But I really enjoyed doing the FA physicals. So I could have just done that. But then I'm losing 2 years of potentially being able to maintain the relationships of people that I'd already started to work with in the fee-for-service location. And they found me, and it's been great. And so a lot of the pilots are like, tell me more about this when they come in for their FAA physicals, and part of my membership includes the FAA physicals. And so the captains for the airlines, they need 2 per year, and the airline reimburses them up to $500 a year. And so that's 2/3 of the membership right there. It's been a good selling point, and they appreciate that I have the ability to not only provide excellent primary care, but advise them in how that might affect their FAA medical certification and what the FAA requires and what you're allowed to take medicine-wise. If there's any hoops, I'll be like, yeah, maybe we'll do Claritin instead of Zyrtec because it's not on the approved list if you've got your allergies. I think that I'm able to provide a little bit, I guess it's my side gig, but it's a good service and it's all based. So that's nice too.
That's wonderful. And you can throw in that little bit about Tricare Prime versus Tricare Select when you're talking to them. Now, going back to how you mentioned that you were in a family moving around every 3 years and that you've been in your locale for longer than that now. How did you come to learn about DPC?
It had been on my radar for about 4 years. And I think I first started hearing about just the cash-based model with Pamela Wiebel and physician burnout, her trying to prevent that, and being a big advocate to prevent physician suicide. And well, I can do that. She talks about having a small office and a tube of lube, and that's it. I'm like, okay, let's do that. And so then I think from there, I got onto some other Facebook pages and then found the DPC docs page about 1.5 years ago, and I was hooked. I have a really good friend that I grew up in college with, and then she ended up going to medical school, and she was the first person I called. I'm like, I think I'm doing this. And she is a pediatric DPC in the Fort Worth, Dallas area. I call it Fort Worth, Dallas because I'm from Fort Worth, so it's not Dallas, Fort Worth. And she spent, 2 hours on the phone with me one night and was like, this is this, and this was helpful, and this wasn't. And that was just the first introduction to the DPC community. And then it was just this floodgate of amazing information and wealth of knowledge and just support and compassion. And it was a complete breath of fresh air from even the small practice I came from, fee-for-service, but the hospital systems and the corporations I worked for. It was all business, money, bottom line, and patients were there somewhere. And it's been just great to be able to be a part of this community. And I really hope to give back as much as I can. And you're doing great with just My DPC Story. I love it.
Awesome. I am glad that people like yourself, when you talk about that you really learned more by being in the community and talking with other people in the community. This is another branch of that idea because it's your words being shared to hundreds of people that are potentially thinking about DPC, in DPC, and just love hearing about DPC. All these people who are in the DPC ecosystem can benefit from your story. So this is definitely another branch of that way of hearing other people's words. When you heard about it about 4 years ago, like you said, and you were in your fee-for-service job, what did you do to plan in terms of your exit strategy for opening HealthSprings Direct?
So I figured out a name, and I made sure that it wasn't taken with the domains elsewhere. So I started with the online community initially because I was thinking I was just going to do telemedicine and home visits and keep it simple initially. I got the LLC. And I didn't say her name, but Andrea Wadley is an amazing pediatrician in Texas. And then I actually went to 2 direct primary care doctors that were in the area, and they have been doing it since 2014. And I had lunch with them, and they were amazing as well. That's Erica Harris and Jacqueline Harris. They're both in Peachtree City as well. And then online, DPCA has been amazing. And I just got back from the Greenville, South Carolina Mastermind with Shane Purcell to Amy Walsh. I was super fangirling over some of the visitors there. I was like, can't say hi, but it was fun. And yeah, I think the most fun of the weekend was meeting Vance Lassie's wife. She's amazing.
That's awesome.
And Dr. Purcell's wife.
That's fantastic. And I know that Non Meta was there as well. So you guys had this like little Georgia group going to South Carolina. So for those people who are not aware of the Mastermind, I'm just going to drop this here. The code My DPC Story, one word, all caps, is still valid for people who aren't part of the Alliance and who want to register for future events. You can go to dpcalliance.org for the calendar of events to sign up, and then DPC Alliance members get $100 off. But Krista, while we're on that subject of the Mastermind run by the DPCA, can you please share what the actual experience was like in addition to fangirling out? Because I love that. But what were some of the things that blew your mind by going to an in-person event?
It was nice because there was about 15 of us, and in every single stage of DPC, from very well-established multi-location practitioners to I may do this someday. I'm just kicking the tires and looking under the hood, seeing if this is what I want. And we all talked about different things as far as marketing and supplies and how to do the business part of DPC, which is something you don't learn in medical school. And yeah, I've had a crash course drinking through a fire hose with business alone in this adventure. One of the nice things was we got to tour 5 different direct primary care offices, and huge and some really modest. And how do you set up where does the centrifuge go? Really, just little details that I just don't want to have to learn on my own. And they've, again, been so forthcoming with the do it this way because I learned the hard way. And it just made starting this so much easier than it would be. And there's tons of other people out there that are also helped through DPCA, Tiffany Leonard, Julie Gunther. It's a great community, and I'm really happy and thankful to be a part of it.
Wonderful. Thank you so much for sharing that. Okay. So because you had been in your community in your previous fee-for-service job already, what type of market research did you do, if any, before? And I love the laugh. That's most of us, including myself. What type of market research, if any, did you do?
Zero, zilch. Like I said, I found my location using a protractor to pick 10.02 miles away from my other practice. And one of the other doctors in the area had recently moved from near where I work now because she had done market research and determined that it wasn't an ideal location, although I have found it to be amazingly ideal. I recently brought on someone to help me a little bit more with social media, website maintenance. And so that's taken a huge burden off, but it's brought in a lot of patients as well. And so I think just word of mouth and getting it out there online and that search engine optimization stuff that they talk about, we even went into that a lot with the Mastermind again.
And when you mentioned this other physician saying that your area and your building wasn't in an ideal area, what were some of the reasons that physician said that?
I think she had looked at her patient demographics and noticed that they were mostly coming from more south regions. And so she just moved her practice to about, 8 miles south.
I love that you mentioned this 2 and 5 year plan earlier. So when you look into the future and you envision your 2 and 5 year plan, what does that hold for you?
It would entail getting more than one room. And the nice thing about the executive suite is I could rent 4 rooms in this place and I can expand. And so I'll probably do that actually sooner than 2 years. I have some really great staff that I'll be able to hire after that 24-month non-solicit agreement has been up, and expanding staff for medical assistants, office assistants, but also potentially a physician assistant. That would be nice to be able to help and expand with marketing to employers. So I have done 3 pitches to different employers, and at this point, they're all waiting for the open enrollment situation. I would like to be able to offer that a little bit more. I've gotten involved with the local businesswomen groups and Chamber of Commerce. And so it would be nice to be able to help the commercial aspect in the area as for healthcare to provide a little bit better options for healthcare for employees.
When you opened in January, and now you've been open at the time of this interview 9 months, and you just shared that you even talked about like the business aspects of running a DPC at this last mastermind. What was your workflow like when you opened, and how has it changed or even been impacted by things like this recent mastermind?
Initially, I wasn't needing to go into the office every day. And so I was able to bundle the appointments in person together. And lately, I've been there Monday through Friday. And it's really nice because I can be a whole lot more flexible with kids' activities. I have an 8 and a 10-year-old boys, and they have things that I need to do to help them. And sometimes my husband's out of town flying. And so I'm able to be a whole lot more flexible. And I love that I know my patients so well. So I can say, hey, I have a PTA meeting. I'm really sorry. How is 12 instead of 10? And everybody is so amazingly understanding. And they'll say, are you taking care of yourself? I think you're not charging enough. Are you getting enough sleep? Thank you so much. But more than anything, people are like, you just look so much happier. You just have this glow and you didn't have it before. And I can tell this is where you need to be.
It's so wonderful. It's so wonderful. And I'm so happy that it's common to hear that is the difference between a fee-for-service job and running one's own DPC. So that's wonderful. When you were opening, at what point did you make the decisions for an EMR and billing software to be the tech running in the background for your DPC?
I had a grand plan to just use Google Workspace because I wasn't going to have that many patients and I wasn't going to have a brick and mortar. And started off with that, and I just got way overwhelmed. And so I ended up going with Servo as the electronic record. I have been, again, all over the country. And so several of the hospitals I worked with as a hospitalist, nocturnist, even the companies they had, I think I've done 12 different electronic records. Epic's amazing. It's like, $40,000. So not an option. And it's just way too busy because if you don't need that, you need something simple. So I really vetted the 4 main options, and everyone was, again, really helpful and supportive. I did end up going with Servo. I think it's because it's really colorful. Kind of superficial, but it makes me happy when I open up and the rainbow is right there. And it's just, yeah, but it's all very functional and easy to use. It integrates with Hint. I got Hint probably the very first thing after I did my website, and that's been really helpful. Servo does automatic billing, but looking forward and potentially working with employers, Hint is going to be a better option because they'll have their own portal. And we talked about all the other resources. Hint has been a great resource with direct primary care. They really support and encourage the DPC community. And I enjoy learning from their videos. And I think there's going to be a Hint Summit coming up as well soon.
This is just a side note. The Hint Summit was my very first summit that I ever went to. And it was like, I don't even know what Hint is, but Janine Rodon told me to go. So I'm here.
I didn't even have really jumping ship from fee-for-service on my radar until COVID hit, and needed to have a lot more flexibility and just was ready to be my own boss. And so I didn't get to go to any of the things in person. And so it's been, I guess that's why the mastermind this past weekend was, again, so amazing, is because I haven't been able to network in person. And there's just so much you miss from having to be online. And I'm looking forward to when it doesn't have to be online any longer.
With you using Servo and with you using Hint, in terms of making the EMR work for you rather than you working for the EMR, because as a Cerner user of too many years, that's the biggest contention point for me in that I want the tech to work for me. How are you personalizing your Serbo to make it work for you?
So I customized it and put all the specialists in, but I put all the physical therapists in. I put all of the home health agencies in. I put all the high schools in for return to school notes. And then I took all my macros that I had at the other practice. I typed those in and I have made a ton more. And the nice thing is that it's not just a macro in Serbo. It can pull in diagnoses with the ICD-10. I know that's a cuss word, but it does it automatically. And it can include orders, and it's really, if you can get it, it takes, again, a lot of upfront work, but that's one thing that I probably should have done the month before I was opening, was really focus on that instead of just doing it. And my office assistant has helped me significantly. She's learning that there's a lot of admin, not always fun nursing stuff, but I'm very thankful for her. So shout out to Kaylee.
That's awesome. And being a Serbo user myself in that build out stage, it's just the idea of, including the high school fax line, like that's a gem. So I'm really glad that you shared that. And I definitely will say that, like, just from personal experience, the responsiveness to the
amazing support.
Yeah. The support is just like within minutes. Sometimes I'll get an email response, and my support person at Serbo, Marie, is always open to meeting as I need to. So I'm sure you've experienced the same. Yeah.
We had a great onboarding process, and they were daily, if not hourly emails initially. And then they let you go on your own like a grown child. So, every now and then I'll need to reach out to them. One hiccup I did have is that, I guess 5 months in, I woke up on a Sunday morning and I had 8 emails from Facebook saying, your password had been changed, you've been removed as the business administrator, and you've been taken off all, access to Facebook. So somebody hacked and took away my entire Facebook personal, but also my business. And so that was really disconcerting. And Facebook really doesn't have any sort of support along those lines to help you. And I was really mad, mostly about the pictures. And thankfully they weren't posting. They haven't been posting. But in that process, I was like, you know what? Parents have been saying, I want you to take kids. I want you to take kids. So in that 5-year plan that I have, I needed to drop the internal medicine and potentially change the name to include kids down the road. And so I was like, you know what? My Facebook's gone. I don't have access to it. I can't get it. Let's change the name now. And so Hint and Serbo were all really very helpful with that process, and I appreciated it. And yeah, don't go to HealthSprings internal medicine, or don't go to HealthSprings, and you can actually go report it if you want to. That'd be great. But the new practice is HealthSprings Direct, and that's been going wonderfully. And I have all the security measures in place. The first thing I did was do a name change with the LLC. Then you had to go with the banks and the credit card. And then I went with more online presence thing. And then I still use some of my old internal medicine cards for reminders for upcoming appointments. The information is still the same. It's just, and the website still forwards. And so that's been really helpful. With Ashford Creative helps to do my website and social media, and they've been amazing. And so he was really helpful with helping me transition with that too.
Now, so I want to ask about the pandemic, because you mentioned starting out during the pandemic, but now that Georgia is unfortunately one of the states where the number of ICU beds is extremely low, how do you talk to patients about COVID, the vaccination, because you are now with that 5-year plan incorporating kids into that plan? So I'm sure parents of children who might join your practice later are asking your advice. So how do you handle that?
They're all coming to me with these articles that they find on social media or what they've heard, and I can find data to support whatever decision I want to make. And I'm like, yeah, but do you want to talk about the real data and the helpful data? And it's the data that I would, put my money on in Las Vegas. So it's objective. It has, nothing to do with politics and nothing to do with what side of the aisle you vote on. It doesn't matter. It's science, and that's what's so nice. And it's one of the reasons I love medicine. And I have converted a lot of people in the area one of the biggest things in the last week is they pulled the National Guard into our local hospital because they have a 14-bed ICU and they have 54 patients on the ventilator. And it is just completely chaotic and super stressful. I have a couple of nurse ICU staff that are really struggling just to keep up with the emotional and physical and mental demands of that. So when you tell them that, and these are healthy people and 95% of people in the hospital are unvaccinated, that kind of has turned the corner for a lot of people.
Yeah,
and I give my patients a I'm vaccinated little button that I got off Amazon. They're super cheap, but the patients love it. They feel like they're getting a toy as a kid. And they wear it. They love wearing it.
You mentioned earlier that you're dealing with a lot more anxiety diagnoses right now. How are your patients utilizing your services and their membership to help them get through COVID times, in addition to you talking about the science?
In addition to me posting my obligatory I got vaccinated picture that they had to get extra staffing for just for the photography, I did it right away. I did it December 15th, really the first week I could do it. I ended up delaying one day because I got an amazing deal on a exam table on Facebook. So I'm like, oh, exam table, COVID vaccine. So I did delay one day, but it was a really good deal. And so I have gone to the vaccinations with my patients. I have 2 patients that have just really significant drug sensitivities and reactions, and they don't want Tylenol. And so I've gone with them with some medications in case they need it. And a lot of times I say, you know what, you may not feel great. And they're really just worried about not feeling well after the vaccine. And I said, how about you just plan on it? How about you just get a babysitter, get your Netflix queued up, your Tylenol, ibuprofen, your water, and your comfy pillows in bed, and just plan on it. If the kids need to be in school, do it on a Monday. If you need a weekend, do it on a Friday. And if you don't feel bad, then yeah, there was nothing to worry about. And if you don't feel great, then you plan on it, and it's something to be expected, and you know that the immunity is working.
And all of those reactions, if they can be dealt with at home, much better than any ICU bed ventilator. So
I absolutely tell people, you're not choosing to get the vaccine or not, you're choosing to get the vaccine or you're choosing to get COVID. And we know a whole lot more about the vaccine, and we're just like skimming the surface about this long-term COVID stuff and some of the long-term ramifications.
Having shared your experience of how you have been involved with your community during these COVID times, I want to ask about your best and your worst days and your best days in DPC so far. So looking back on your 9 months you've been in practice already, what was one of your worst days and what was one of your best days?
The worst day in DPC is better than any day in fee for service. So I can't really pinpoint a worse day. There have been busy days, and there's been days where I stay late for especially older high schoolers and teachers. And so, yeah, my husband does dinner and he's amazing. He's so helpful. And I come upstairs and I kiss the boys goodnight. But I guess one of the better days is I had an 8 a.m. patient, and she said, are you doing okay? How are the boys? And I said, I'm actually about to go to a school to check it out because my son has dyslexia and is doing great with it, but needed a little bit extra. And so she goes, are you talking about the Bedford school? It's amazing. You tell them I'll donate a week at my Georgia Mountain Cottage for their fundraiser. It's going to be great. I'm so glad he's going there. And so I was able to take care of her, run up the road, see the school, yay, and then come back and do more. And again, the community gives me all the feels.
I have so many patients who are like, hey, remember, I'm still here. So if you need a babysitter, just bring them over. So that's awesome. And I love, how you shared even that your boys are 8 and 10 and you're able to have way more flexibility, the flexibility that you need to for their changing schedules. Now, in terms of closing remarks, is there anything that you wanted to share?
I guess one thing I would say is that every place that we moved, I did something a little different. And that really got me out of the box thinking to expand my, not necessarily scope of practice, but comfort level in different environments. And I'm really thankful that I did that because I feel a lot more comfortable providing many treatment options for patients. I loved kissing Blackwell's Q-tip up the nose. I cannot wait to try that. I'll probably do it on myself first. But those kinds of things where even telehealth, I think that is an amazingly powerful way of communicating with your physician when it's appropriate. And my former employers have been less than open to more of the new technological things and alternative treatments. Towards the very beginning, I ended up going to a dermatology visit with a patient who had pretty significant mole on the side of her face. And I was like, oh, that's on the face. I'm not comfortable. It's been so long because we didn't do that in my old practice. And I definitely wanted to work on skin lesions. I'd done it before. And so he does it. I'm like, oh, I could have done that. Some of that is not the imposter syndrome, but the lack of confidence. And you just got to jump in with both feet in DPC and the procedures that you know, and put on your big girl panties and walk around the room like my grandma used to say.
It's a great quote. That's a great quote. I'm sure she would love that you shared that with the whole DPC ecosystem. That's wonderful. When you talk about this imposter syndrome and expansion of skills, are there any particular programs or resources that you found helpful in terms of expanding your set of skills or making you more confident in the skills that you want to be practicing?
Absolutely. Urgent care was. As an internal medicine trained person, we didn't do much of the procedures and OB and kids, and the urgent care environment you went in, again, feet first. And I had some great mentors with Texas Med Clinic in San Antonio. And I'm really thankful that I had the time there. And yeah, I'm glad I did that. It's one of those, it was, scary at first. And looking back, it was exactly where I needed to be to get me exactly right here. Who knows what's going to happen in the future, but it definitely gave me a skill set I didn't necessarily get through residency.
And when you talk about the future again, I want to ask about resources that you're currently using to help you along your 2 and 5 year plan. What resources, whether they be podcasts or books or any resources that you found helpful, could you share with the listeners what you found?
I think the most helpful is DPCA, definitely, with just the wealth of knowledge that not only they have on their website as members, but just the discounts are amazing as well. And then the DPCA Facebook group specifically for members, that it was a really good investment early on. So even if you're contemplating it, it's definitely worth that investment over buying Google Workspace. As far as the other things that have helped, there's Rubicon. I don't use Rubicon. I use a different kind of platform that I'm able to access through a volunteer clinic that I work with, the Healing Bridge Clinic, which is for underserved in the area. I'm there every other Thursday. And that's been amazing to network with the physicians that provide care there. So locally and globally online. The Maven Project is helpful for consults with specialists online, face-to-face, and either you can type it up or you can do a video conference. And then UpToDate, that's an UpToDate. I love it. I love it mostly for the resources to be able to give my patients. And then I am looking forward to doing an Institute of Functional Medicine course, just the introductory course starting next week. So that's something I've been looking forward to a long time. They just don't teach quite enough about nutrition and the other behavioral aspects of disease processes. And I'm really looking forward. I've known it for a while and tried to give my bits and pieces to patients just from my own personal experience, but now I'm going to have a little bit more breadth of knowledge to convey to them.
Wonderful. And now I want to ask, in closing, for doctors who are not yet in DPC and who have hesitancies to join the movement, who have skepticism about, can this work in any community? What would you tell a physician who is exploring the world of DPC and thinking about making
Do it now. Do it as soon as you can. You're going to be way bigger than you expected to be, which is a great problem. And pounding the pavement, getting out there, and really investing in your patients and their lives, again, within the community, has helped a ton with word of mouth. But again, it's been the best decision I've ever made. And I'm really, professionally anyways, I'm really thankful I did it. Yeah.
Awesome. Thank you so much, Dr. Springston, for joining us today.
You're welcome. Thank you for having me.
Next week, look forward to hearing from Dr. Ken Richter of Scotland Family Medicine in Scotland, Pennsylvania. The 2021 HINT Summit will be held virtually October 28th to 29th. Register today at summit.hint.com. Please mention this to any medical students or residents you might know as well, as it is free for them to register. For those interested in point-of-care ultrasound, check out the next in-person course at the end of this month in San Francisco. And if you're looking for a DPC-focused marketing company, check out Marketing Beaver, who can help you get started for as little as $3 a day. Check out mydpcstory.com to learn more. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcasts. Tell your friends too. For more information on this episode and much more, including DPC swag, please visit mydpcstory.com. Also, for the latest in DPC news, check out dpcnews.com. Until next week, this is Marielle Concepcion.